Welcome to the 6th Centennial Lunch and Learn talk. I'm Karen Thomas. I'm the historian of the Bloomberg School of Public Health. And this talk is titled Precedent, the Creation, Johns Hopkins, Bloomberg School of Public Health, and the CDC, NIH, WHO, and USAID. We are only going to focus today on the CDC and NIH, and we will deal with the global health aspects at a later talk. So what I want to look at today is what were some of the precedents and the political context for creating some of the cornerstone agencies in public health, specifically the CDC and the NIH. And what role did our faculty and alumni play in establishing and setting the priorities for these agencies? And these agencies played a really key role in shaping both the research and the teaching at our school. And finally, I'll talk a little bit at the end about how this mid-20th century shift between World War II and about 1965 or so, the shift from private to federal funding with the new creation of these agencies really shapes both our school and all schools of public health. So in a previous talk, the very first one, the dynamic science of public health, I talked about the fact that our school was originally named the School of Hygiene and Public Health. And I had actually mentioned that in my mind, the NIH is kind of the hygiene side, and the CDC and the Public Health Service are the public health side. So I want to talk about the precedents and the context of how and why these organizations were created. So I want to start with the Public Health Service Hygienic Laboratory. That was an absolutely foundational institution in the history of public health research and practice. And many of our faculty and alumni worked for the hygienic laboratory, continued to be consultants for the hygienic laboratory after they came on the faculty. Before it was even called the Public Health Service, it used to be the Marine Hospital Service back in the 19th century. Joseph Kenyon established the hygienic laboratory in 1887, and it was a single room. And yet, within a couple of months, this one guy in this one room had discovered the cholera microorganism that causes cholera and identified it as the definite etiological source. And he went on to do amazing things. He headed the hygienic laboratory in its early decades. And around 1902, and this is during the Progressive Era, when kind of social housekeeping, but also literal sanitation and cleaning up cities is in vogue and is really getting started. So in 1902, some major federal legislation that's going to shape public health and the NIH later on is passed. So in 1902, Congress passes legislation that creates the Division of Pathology and Bacteriology. And the hygienic laboratory is housed within this division. And this is the first time, so Kenyon was a physician, and research in public health up to this point had really mostly been done by physicians who are honestly kind of dabblers in the scientific side. But in 1902, this authorizes people with PhDs in science to come in and work in the hygienic laboratory and in the Division of Pathology and Bacteriology. And that begins, a real full-fledged commitment to scientific research in the service of public health and medicine. So the next year, Congress also passes the Biologics Control Act, And maybe some of you know what biologics are, but that's basically vaccines and toxoids that are, preventive measures. And there are very few preventive measures at this time for diseases. You have the smallpox vaccine that had been discovered by Edward Jenner back in the 18th century. But there's relatively few diseases that can be prevented at this point. But the research that the hygienic laboratory and this division does is going to change that. So Congress authorizes the Division of Biologics to make sure that the vaccines and toxoids that are being used are safe and effective, okay? So that is huge. That's gonna set the pace for much of what's gonna come afterward until we now have, formal drug approval processes and various phases of clinical trials that are now handled by the Food and Drug Administration, but that used to be, back in the day, part of the hygienic laboratory. So I'm going to skip ahead a bit to World War I and 1918. This is when the great influenza pandemic is going on. And before Wade Hampton Frost comes to the School of Hygiene and Public Health as the first professor of epidemiology in the United States, he is already working, he's a public health service officer. So in 1912, the Marine Hospital Service is reorganized and formally becomes the Public Health Service, and its authority is expanded and its budget is increased. So a few years after that, Wade Hampton Frost is called upon by the hygienic laboratory and the Public Health Service to investigate the great influenza pandemic. And it's important to remember that at this point, barely anyone knows what epidemiology even is. It's a very tiny, tiny scientific discipline within the larger framework of medicine and public health. But Frost uses cutting-edge epidemiological techniques to determine what is the scope of the pandemic in the United States and how did the pandemic spread and what were the causes. Because influenza had symptoms that were similar to other diseases and there were not very good laboratory tests yet, it was hard to even be sure that what you were diagnosing was influenza. So you can see what Frost was up against. But he does an intensive epidemiological investigation and reports back to the Public Health Service on the scope of the pandemic in the United States. So that is a major milestone in the history of epidemiology. And that is the same year, or actually the following year, 1919, he is appointed here as a professor of epidemiology at the school, and he becomes our first chair of epidemiology. So you can see that there is this very close interaction and evolution of public health science, research, and education that's going on here. So in 1930, so the hygienic laboratory continues to grow, but it's still a very small part of the Public Health Service. It's kind of an elite research branch when most of the rest of the Public Health Service is really focused on sanitation and maternal and child health and things like that. In 1930, you get what's really the kernel of the National Institutes of Health, and that's the Ransdell Act, named after a senator from Louisiana, Charles Ransdell. So this creates the first fellowships that are federally funded, and it renames the hygienic laboratory as the National Institute, singular, of Health. So you have the beginnings of what's going to become a major center of research and training in medicine and public health. But in 1930, because of the depression that's going on, it's still very small scale. In 1937, you get the creation of the first disease-focused institute, the National Cancer Institute. And very importantly, this sets up the first extramural grant program. That means that instead of only being given to scientists who are employed within the public health service and the hygienic laboratory, this gives people outside those agencies the chance to do research. So as you can imagine, if you know anything at all about the Bloomberg School, that's going to be very, very important for us. So in 1944, the Public Health Service is reorganized under the Public Health Service Act. And this is really what gives us the modern public health service. So you can see 1944 is, of course, in the middle of World War II. The war gave the Surgeon General at the time, Thomas Perrin, and the Public Health Service, I would say almost carte blanche to do what needed to be done to protect the health of not only soldiers who were stationed all over the world as well as being trained in the United States, but also civilians. World War II is the first time that the Public Health Service and the military really get into the business of protecting the health of civilians as well. And one of the things that they're going to do is to try to prevent malaria in the southern states where, because of the dominance of Democrats from the South in Congress, the majority of military bases are built in the South. So that means they're built in malarious areas. Okay, so we're going to get to that in just a moment. So there's a massive increase in overall federal spending. Federal spending during World War II is 10 times the amount that it was under the New Deal. And the New Deal increased it quite a bit. But it's really World War II that drives scientific and medical research and the dramatic expansion on really a permanent basis of the whole public health infrastructure in this country. So the wartime expansion of the Public Health Service, which at first seemed like an emergency measure, under this Reorganization Act in 1944 becomes permanent, okay? And even though World War II ends in 1945, you may hear the phrase hot war, cold war. Well, a lot of the concerns are going to extend well into the next 2 decades as China becomes communist because of the Maoist revolution in 1949, and then as our rivalry with the Soviet Union heats up, even though they've been our ally during World War II. So all those things are really going to affect the growth and development of public health. But World War II is kind of the trigger for a lot of this. So one of the things that the Public Health Service Act authorizes is that is a greater attention and funding and organizational structure for research, okay? So instead of a single National Institute of Health, we're going to have multiple institutes. So the National Cancer Institute is kind of pulled into, and then we still have, you know, the laboratory and research function that the hygienic laboratory had. And also we create, so with the 1948 National Institutes, plural, of health, we now have not only cancer, but also a Heart Institute, the National Institute of Mental Health, and an Institute of Dental Health. And then in addition to that, what had been, you know, the biologics part and the hygienic laboratory becomes the National Microbiology Institute, okay? So we've got lots of institutes proliferating, and the late 1940s is just the ideal time. If you want to get anything funded in Congress for scientific and medical research, it's like, you know, the golden era, okay? So we'll get to that in just a moment. So going over to public health. So where is the public health side in all of this? So back in 1909, I could have started this lecture by saying it all begins with worms, because it really does. It begins with hookworms. Charles Wardell Stiles was a researcher for the hygienic laboratory, and he is focused on the American South and what was called the germ of laziness, okay? Hookworm was a parasite that would get into your intestines, and it would cause anemia, and basically you would begin to waste, you would begin to lose weight. And hookworm is such a problem, particularly in the South, because the South was by far the poorest part of the country, and people were walking around barefoot. It's a warm area, people were walking around barefoot, and hookworm is spread in the feces of the people that have it, and then we had a great story in the newest issue of the magazine on open defecation, okay? Well, that's what's going on in the American South in the early 20th century, and that's why hookworm was such a problem. And unfortunately, it was especially the little children who, even today, little kids love to run around barefoot. Well, the kids were running around outside, and they're actually very close to the ground. So it's the kids who are really suffering from hookworm. So Stiles, frankly, he's a bit of a jerk. He's not easy to get along with, but he's very, very laser focused on hookworm, and he wants to eradicate it. And he says, I know how to do it. You have to do sanitation, you have to have sanitary privies, toilet facilities, and you have to use a drug called thymol, which is a vermifugel. It flushes the worms out of your system, okay? So we can use these two simple techniques, and we can eradicate it. Nobody has ever talked about eradicating a disease. I mean, there's so many diseases at this point that can't even be identified, much less treated and cured. But here's Charles Wardell Stiles saying, oh yeah, I'm gonna just eradicate the whole thing. So he seems like this crazy dreamer, but when he talks to John D. Rockefeller at the Rockefeller Foundation, he gets in the door because the Rockefeller Foundation is originally very focused on Southern education. And they realize that, well, kids aren't coming to school and they're not learning very well because they have hookworm. So it's a means to an end. They want to improve education, but they kind of go through the back door of the hookworm campaign, okay? So that sets us up very, very well. The hookworm campaign introduces the whole idea of eradication. I mean, think about how much our school has been involved in various eradication campaigns. D.A. Henderson and the WHO campaign to eradicate smallpox. But that word first comes out of the mouth of Charles Wardell Stiles, crazy dreamer that he is. So John D. Rockefeller, who has lots and lots of money from Standard Oil, thinks, hey, that's a pretty good idea. Let's see if this works. So the Rockefeller Foundation and the Public Health Service create this close collaboration. And not only does it create this campaign, the Rockefeller Sanitary Commission for the Eradication of Hookworm, but it's this perfect entry point to spread the gospel message, because this is the progressive era, the gospel message of public health around the South. And it helps to create a network of public health departments and raise public awareness of the need for training those professionals to staff those public health departments. So it's really, in many ways, the beginning of public health in the United States and the beginnings of our school, because we are the ones that the Rockefeller Foundation taps to begin training these needed public health professionals to create this network of full-time public health departments. So in 1915, what had been the Hookworm campaign turns into the Rockefeller International Health Division. Okay, guess where nearly all of our students are funded by in the first several decades of the school? The Rockefeller International Health Division. So the Health Division sends people not only to the American South, but also to Latin America and to China. So our early faculty and alumni are either coming from the International Health Division, or they're getting trained here and going back to the International Health Division. And it's really the International Health Division and the Pan American Sanitary Bureau, which is founded right after the turn of the century. Those two organizations, Rockefeller International Health Division and Pan American Sanitary Bureau, are really the beginning point of global health in the 20th century. But we're not going to get too much into that this time around. So, as I had said a minute ago, malaria is a major problem in the American South. So we've got hookworm, we've got worms, and then we've got malaria, a different kind of parasite that's also spread very prominently by the ecological and economic conditions of the South. Again, because it's the poorest area and because it has this warm climate and there's lots of mosquitoes. And people who are poor are living in houses without window screens, and they have poor nutrition, and they're very susceptible to infection. So malaria is a problem in the South, even up until World War II. You know, we think, oh, malaria, that's in the developing world. No, malaria was right here in our country until not that long ago. So during World War II, the CDC, the Malaria Control in War Areas program is created to protect the health of both the soldiers who are being trained on those southern military bases and the civilians who live around them. Because there's all these southern boom towns that are created during World War II because the defense production industries and just the construction of these military bases are bringing in thousands and thousands of people. And the people who are coming in from the rural areas, they were already exposed to malaria, but now there's a large number of people concentrated in one place. And that makes control measures much easier. So one of our graduates, Justin Andrews, he's a 1926 Doctor of Science in Hygiene graduate in parasitology, and he's an expert on entomology, the study of insects that are disease vectors. And he's actually on the faculty in parasitology from 1926 until around 1937, I think. So in 1937, after he's trained a lot of the world's top parasitologists while he's on the faculty here, he goes to the Georgia State Department of Health, and he sets in motion what really becomes the modern methods of malaria control in Georgia, which is a very, very good place to try to control malaria. Think ahead a little bit. What major public health agency is established in Atlanta, Georgia? Ding, ding. Okay, so it's malaria that's driving the creation of the Malaria Control in War Areas program. It's defense priorities that are pouring money and political support into these programs, and they are going to be the core of what becomes modern public health in America, and later, in global health. So Justin Andrews had done a fantastic job in Georgia, and then he was recruited by the Public Health Service to work with a man named Joseph Mountain and Mountain was the one who really creates the Malaria Control in War Areas program, but Justin Andrews is, I would say, he's really a major part of the brains of the operation. He plays a really fundamental role so just as the Hookworm campaign had these two simple methods, the thymol and the sanitary toilets, and by the way, wear shoes, don't walk around barefoot, basic public health education messaging. So too, the malaria control campaign was also fairly simple. It used vector control. So in the days before DDT, there was an insecticide called Paris green, and you would, and it had, I think, copper sulfate in it. It was a bright green color. And so you would apply that on any stagnant water, and the Works Progress Administration during the New Deal was also trying to drain the swamps, which would also help control malaria. So they were using those methods. But it's not until the introduction of DDT, a very, very powerful insecticide during World War II, that the malaria control programs gets this big boost. And Justin Andrews and another one of our alums, Fred Soper, who gets a Doctor of Public Health in, I believe, 1925. So Andrews and Soper graduate right together, and they're both global figures in the malaria control campaign. Andrews is helping with the malaria control in war areas in the United States, and he also works for the military overseas, and so does Fred Soper, okay? Fred Soper becomes the director of the Pan American Sanitary Bureau, becomes the Pan American Health Organization. Andrews works with his good friend Joseph Mountain, and together they create the Communicable Disease Center, the CDC, in 1946, which is a direct outgrowth of that malaria controlled in war areas program. Okay? So that's kind of the setup. So I want to talk a little bit about just how small the world of public health was. And there were these, so one of the things that I really emphasize in the book that's coming out is that there are these intellectual networks that spread all around the world, and they connected people and organizations and resources. And this was how knowledge spread from one person to another and one place to another. Okay? So I want you to take a look at the photo on the left, which is the epidemiology faculty here at the school in 1935-36. So on the lower row, second from the left, is Wade Hampton Frost, the guy that I mentioned earlier who did the major report on the great influenza pandemic. So he's chair of epidemiology. There's only 8 people in the whole department. This is the largest epidemiology department in the world, but there's only 8 people. So the gentleman directly behind Wade Hampton Frost, second from the left on the top row, is a man named James Watt. Okay, so he gets his degree here in epidemiology in, I think, 35, and then he immediately joins the faculty. So a lot of we were hiring a lot of our graduates because we were one of the few schools of public health producing these people. So Jim Watt, Justin Andrews, Fred Soper, and then another guy that we're going to talk about in a minute, James Shannon, they're all getting their feet wet in public health in the malaria campaign. Okay, that's the way all of these guys are being trained. But one of the things that I find so fascinating about all these figures in this history is they could switch hit like nobody's business. They knew malaria intimately and well, but they go on. You know, James Shannon is the one who really fosters, in his leadership of the NIH, James Shannon, who had been a malariologist, expands the scope of the NIH to embrace all of chronic disease, and he really is a mastermind at convincing Congress to fund the NIH, and the budget of the NIH, I believe, increases about tenfold under his directorship. So, you know, we can be highly specialized sometimes today. I know that there's a great article by Carlos Castillo Salgado, about putting the PH back in PhD. These guys were Renaissance men and women. You notice there is one woman on the epidemiology faculty in the lower left corner. That's Miriam Braley, also an alum. And she does some of the first work on racial disparities in tuberculosis. But today we're focusing on the NIH. So Frost and Watt, they have the clout and the name recognition of having come from Johns Hopkins and the School of Hygiene and Public Health. But Frost loved working with a hygienic laboratory so much that he was really reluctant to become a full-time professor. Even though we claim Frost as ours, and rightly so, he was actually continuing to work with the hygienic laboratory until about, I think, 1930. Okay, and he began to feel like, I don't think I can do both of these things at the same time, and I want to, be accountable, and so I'll go on full-time with the school. So the man on the right is, and James Watt, the guy in the back row, he starts out as a malariologist too, but then he becomes the director of the National Heart Institute, okay? Can you imagine today going from being a malaria specialist to directing the National Heart Institute? I mean, that's a pretty big jump.
It was a surprise to him as well. So he's been to the school while I was in.
Mm-hmm.
I know his offspring, bakers, well. He gave some lectures here while I was in. And so he told us the story, went on a number of times, that they have been living around the world, and his wife finally said it's time to go back to the United States. And so they came back, and he called up his then boss, Surgeon General, and said, well, what should I do? And he said, when you think about it, I know you'll be the director of the National Heart Institute.
Right.
And he said, I don't know anything about heart disease. He said, don't worry, go to the library, you'll find out more.
Right. So, these are the days when jobs like director of the National Heart Institute were given out with a phone call and a handshake, okay? This is how small, how intimate, how informal everything was back then. And the school was very much at the center of that network. So Kenneth Mace on the right is someone I just admire tremendously. There's so many things that I could say about him. So he is in our first graduating class. He gets his Doctor of Public Health in 1921. He also goes straight to work for the Public Health Service as a officer out in the field, and he is investigating, and he was taught, he's a student of Wade Hampton Frost. So we're going to do a little bit of genealogy here, kind of tracing the influence of people down through the generations. So Mace studies with Frost, and then he goes into the Public Health Service. And throughout the 20s and into the 30s, he too is going out into the American South, and he does some really path-breaking studies of malaria. And he identifies, he does examinations, especially of children with malaria, and one of the signs of malaria is an enlarged spleen, okay? So that's something that doesn't require a lab test, and he can, detect that. And so he tries to get a more accurate picture of the actual incidence and prevalence of malaria in these southern areas. And he identifies that the rates of malaria are much, much higher among African Americans. And it's for fairly obvious reasons. They are working as sharecroppers, and they are exposed to mosquitoes much more than the white population is. So he comes in, and then the other thing that Mace is doing, which is amazing, he is doing some of the earliest studies of polio epidemiology, okay? And at the same time that he's doing these epidemiological studies of polio and influenza and malaria, he also is working closely with Abel Woolman, who's our chair of sanitary engineering. And Mace was a leader within the Professional Organization for Sanitary Engineers, which escapes me right now. So he had a foot in several different disciplines. And he's someone who could have been a chair of multiple different departments at the school if he had wanted to. But when he first is recruited to the faculty, he's actually chair of bacteriology for about a year. And then his mentor, Wade Hampton Frost, dies. And so they say, yeah, this guy is perfect for epidemiology. Let's hire him, okay? Can you imagine having our chair of microbiology and molecular immunology and just kind of moving him over to epidemiology? You know, I mean, not to slight anyone, but it's a big jump these days, and it wasn't back then. So as chair of epidemiology, Kenneth Mace really ushers in the era of modern disease-focused research at the school. Very shortly after becoming chair, he secures the first National Foundation for Infantile Paralysis grant. So this is a private foundation that's giving a major grant to create what is the first research center at this school in 1942. Okay, and it's the Polio Research Center, and it's based in the Department of Epidemiology. But the precedents of the NIH and the CDC are very much housed within infectious disease and in research such as the polio research. At the same time, the American Cancer Society and the American Heart Association and other private disease-focused foundations are funding similar types of grant programs. The American Cancer Society grant program really gets going in, I believe, about 1947. So even though these private foundations are ramping up their research programs, and the school is very much benefiting from that, the methods and organizational structure and administrative ideas are being transferred from those organizations to the NIH, okay? So some of the things that were developed by the Rockefeller Foundation and by the NFIP for the polio campaign are then adopted by the National Institutes of Health in their research program. And one of the key things that is a building block of the school is the idea of indirect costs, okay? Do you like this room and this building that we're standing in? So indirect costs is the idea of keeping the lights on, okay? There are many, many costs associated with research that don't get paid by, paying the researchers and the equipment and the direct costs, okay? So indirect costs are first adopted by the National Foundation for Infantile Paralysis, very much under the influence of both the Rockefeller Foundation and Kenneth Mace. And indirect costs really make the world go round as far as academic public health research is concerned. So that's an incredibly important example of the idea transfer among these various organizations. So I want to talk now about a real giant. I mean, Frost and Mace are giants, but Alex Langmuir is also a giant. So he was like Justin Andrews, he was on the epidemiology faculty from 1940 to 49, and he got his MPH here in 1940. So he would have studied with, he didn't study with Wade Hampton Frost because Frost had died right before he got here, but he did study with Kenneth Mace, who was, very much continuous with Frost's principles. So in 1947, with the end of World War II and this concern about global politics and the possibility of another world war happening soon, we don't want that to happen, the United States creates the Central Intelligence Agency. Okay, so have you ever seen James Bond movies or lots of other spy versus spy kind of stuff. This is the era when all that stuff really takes off. And it's in the public imagination, okay? There's Hollywood movies, there's novels, people are really thinking about this. Langmuir, in addition to being a great epidemiologist, is an ingenious promoter, okay? So in 1949, now there is a kind of apocryphal story. You didn't know you were gonna get some juicy gossip here, but I'll give it to you. So a man named Philip Sartwell was on the epidemiology faculty, and he liked to give Kenneth Mace a ride to work every day. Tim Baker told me this story. So apparently, Kenneth Mace became very fond of Philip Sartwell, and when Kenneth Mace retires in 1954, Sartwell does become the next chair of epidemiology. Apparently, Alex Langmuir would have really liked to be the next chair, but he kind of saw the handwriting on the wall and said, well, I see this may not be in the cards for me. But aside from all that, he gets an offer he really can't refuse in 1949 to become the first director of the CDC's epidemiology branch. So in this, heating up of the Cold War, one of the first things that Alex Langmuir does in 1951, he says there's really not enough epidemiologists. Epidemiology is still a trade that is learned by apprenticeship at this point. There's no really formal training. Our school and a few other schools of public health are teaching epidemiology, but there's certainly not good training for in the field, on the spot epidemiologists. And that's what Alex Langmuir wants to do. He wants to create just a whole enormous force of epidemiologists who can go out and do, they call them the disease detectives, okay? Shoeleather epidemiology. I'm getting to that, and so this is a point of disagreement, and perhaps Dr. Sommer can speak to this, but in my interviews with D.A. Henderson, who I'll get to in a moment, he said that Alex Langmuir saw academic epidemiologists as shiny pants epidemiologists. That means they sit on their butts all day, okay? So Alex Langmuir, according to Henderson, didn't necessarily have a lot of respect for those behind-the-desk kind of epidemiologists. But other sources that I've read say that it's Wade Hampton Frost and Kenneth Mace who really pioneered the idea and the term shoeleather epidemiology, okay? So, there's debate about that, but I personally believe that shoeleather epidemiology came out of the Eastern Health District and the work of both Frost, Lowell Reed, and Kenneth Mace on the streets here in Baltimore. They were not sitting behind their desks, okay? So we'll resolve that, I'm sure, in the question period. So Langmuir sees that this is a time in history when people are extremely anxious and afraid about the very real threat of possible not only atomic but also biological warfare being directed against the United States. And I think historians and archives that have been opened in the ensuing decades have backed up that fear. I mean, he was not just making that up. There were serious threats to U.S. safety and security. So he sees that by calling his training program the Epidemic Intelligence Service, very close to the Central Intelligence Agency, intelligence is going to be a key part of what Langmuir does in a couple of respects. So he creates what I would call an epidemiological superhighway, okay? So President Dwight Eisenhower creates the Interstate Highway System in 1955, and you may not know this, but it's because it's the Defense Highway Act because we were worried that if there was a war or a major attack on the United States, we would need to move troops and equipment around very quickly. And so our interstates, which I use every single day to get to work, come out of this World War II and Cold War context. So too does Langmuir use the concern about defense to get funding from Congress that we need to be able to respond to a possible attack, and we need to protect our people. So civil defense and responding to biological attacks is the political justification for the Epidemic Intelligence Service, but it also becomes the heart of surveillance epidemiology. So Langmuir creates this surveillance system that evolves to become a real-time data source on all of the epidemics and health threats that are arising around the country. It's quite amazing when you think about that, because we just didn't have the kind of information that we needed. I'm actually I thought I was going to have a tough time filling the time, but I'm not. I realize I need to wrap this up. So the first place where this surveillance system and this very, very important data collection really comes into play is in the Cutter incident, okay? So the school had been very involved in helping to develop the Salk polio vaccine and do the national trials to test the effectiveness and the safety of the vaccine in 1954. And everybody is on this, I would say, polio vaccine high from the success of the trials, and finally people are going to be protected, especially children across the United States are going to be protected against the horrors of polio, which everybody was terrified of. The Cutter incident threatened to destroy all of that. The Cutter incident, one of the manufacturers, Cutter Laboratories, had manufactured polio vaccine with virus that had not been fully inactivated. And kids took it and actually got polio from it. But with the surveillance system that Langmuir had set up, he identified that, well, these cases are clustered in a small geographic area, and when he began to investigate, he saw that the cases came from vaccine that was manufactured by Cutter, and that's why this is called the Cutter incident. So by so quickly heading off this potential horrible disaster, it proved the importance and the worth of this surveillance system. And it also ensured that we would continue to have widespread public support for vaccines, which is pretty unimaginable if that hadn't been prevented. So I want to talk about Langmuir's proteges. One of them is sitting right here with us, Dr. Alfred Sommer. They were all graduates of the school, as was Langmuir himself, and they all worked for him in the Epidemic Intelligence Service, the first one being D.A. Henderson. D.A. Henderson thought he was going to go into pediatrics or internal medicine or something, and he kind of got into it a little bit, and he said, oh my God, this is so boring. I don't want to do this. And so so he was recruited for the Epidemic Intelligence, Service, and he thought, well, I'll do this for a few years and kind of see how I like it. And he ends up becoming really Alex Langmuir's right-hand man. And so I forgot to mention that when the EIS is created in 1951, who does Alex Langmuir go to but the dean of the school, Ernest Stebbins, recommends Philip Sartwell, John Hume, and Abe Lilienfeld as kind of the dream team. If you want to learn epidemiology, those are the people you really want to learn it from. So they are the faculty for the first EIS class. And this is a picture of Alex Langmuir with, you can see the epidemic intelligence poster behind him, but that's, one of the early classes, or at least it's a publicity photo for the classes. So another person who is really shaped by the EIS and its methods. So Henderson, of course, goes on to first head the CDC's smallpox campaign, and he focuses specifically on West Africa. And then he's tapped to become the World Health Organization director of its global smallpox eradication campaign. So Henderson really learns at the feet of Langmuir, and he's one of the people who's really in mid-career and already very, very prominent by the time he comes here as a student in 1959, and he gets an MPH in 1960. So Henry Moseley kind of follows a somewhat similar path, where Moseley is an EIS officer, and by the 60s, the EIS is actually sending people overseas. And that is part of a growing importance of public health as a form of foreign aid and engagement with other countries to win hearts and minds in the war against communism, okay? So Moseley goes overseas to places like Singapore and eventually goes to Bangladesh, or what's then West Pakistan, not yet Bangladesh. But I want to show you a letter. I don't know how well you can see this. So this is a letter from Alex Langmuir to Henry Moseley, who then was called Wiley, in 1971. So in 1971, Moseley is actually recruited by the school to become the first chair of population dynamics. Well, one of the things, so let me read you a little bit of this. So Langmuir tells Moseley, your letter came as a bit of a bombshell, and I've been pondering how to reply for the past few weeks. I know something about this position, being chair of population dynamics, because I was being considered for it myself. And he says, no, thank you. And he says, I will be frank to why the qualification, that I specified as being essential for the first. Basically, he says, you're better qualified than any other living soul that I know. He says this to Henry Moseley, who I wish were here, but he's not. I would love to embarrass him. So what this letter is, and I have a copy of it if you want to read it, but what this letter is, it documents how intimate the ties were between Langmuir and the people that he trained. And when I interviewed Dr. Moseley and Dr. Sommer about their experience in the EIS and their experience of being mentored by Alex Langmuir, they exchanged letters on a regular basis. They were reporting back to each other. And they were exchanging both information, but they were also building a trust and a network of people who they absolutely knew would be fantastic epidemiologists and who they could look to when they were thinking of recruiting new faculty or starting a new project. So the EIS, in my opinion, is one of the most fundamental organizations to the development of this school and especially of its leaders. Because obviously two of our deans, the ones previous to Mike Cladd, were both very involved in the EIS. And if you look on our faculty CV database, many, I don't have an exact number, but a very large proportion of our faculty has served in the EIS, and many of our alumni have also gone into it. So from 1951 until about 1980, the EIS actually trains over 1,000 epidemiologists. So while we're training epidemiologists here at the school, we're not training that many. But in our influence of the EIS, we also play a role in shaping the training of these 1,000 EIS officers. Okay? So it's 1 o'clock, so I'm going to kind of wrap this up. Basically, lots and lots of people in our school were intimately involved in the creation of the National Institute for Mental Health, the National Institute for Allergy and Infectious Diseases. 3 different graduates of ours have been head of NIAID, medicine and public health collaborations at Johns Hopkins were actually integral in creating the NICHD, the National Institute for Child Health and Human Development, in the early 1960s. So there's much more that I could say, but the funding for the growth and establishment of many of our departments that we still have today was offered by the NIH. Both NIH and some private foundation funding helped to create the Department of Population Dynamics. USAID funding was directly responsible for creating the Department of International Health. The Department of Epidemiology has always had a very close relationship with the CDC and the Public Health Service. So there are many other examples I could give, but I just want to emphasize that these organizations and our school really grew up together and had direct influences on one another. Yes?
Dr. Apgar did not graduate in 60 because she was in my class that graduated in 73. I don't know when that's 60.
She was indeed, she got her MPH in 1960. I believe she came back and was teaching or like a visiting person.
Oh, maybe she got a degree twice, I don't know.
Okay, well, I can really confirm, like her biography on the national. Huh, okay, well, I will definitely follow up on that. But she came in 1959 to study with Paul Harper, who was chair of maternal and child health. And then, you know what I bet she did? I bet she came back to study genetic epidemiology with Bernice Cohen and Lilienfeld and those folks. That's what I bet happened, but I don't know. But she did have an association with the school. So these are my takeaway points. I think I've made them, and thank you very much. So, any questions? Yes?
You didn't mention, but I think the first lab of hygiene was here in Baltimore, was it not, up at the Marine Hospital? It became a public health center.
Well, there certainly was a Marine hospital here in Baltimore, but I do not think that the laboratory was created there. I will look up where it was created, but it was not created here. It was further north. Pardon?
Near the Baltimore Museum of Art.
Okay, well, I will follow up on that, but I do not think it was in Baltimore. But if you want to email me, I will certainly let you know what I find out. Anyone else? Any other questions? Okay. Thank you very much.